Hello, my name is Bradshaw. Hygiene, curtain. I'm a student nurse. I've got orders here for you, but before I do anything, can I have you verify your full name and your date of birth for me? E.V. Stevens, 1121. Okay. And so these doctor's orders are to go ahead and do a blood draw. You've had this done before. And so you know when we do the blood draw, we're going to go ahead and change out the cap off the top of your central line. Just a quick overview real quick. Every 7 days we go ahead and change out that whole dressing, so we're going to go ahead and do this dressing change. The cap change we're going to do every time that we do a dressing change, every 7 days, or we'll do it every time we draw blood, or every 96 hours if we're infusing lipids, which is a nutrient substance that kind of fatty for you. But right now we're not infusing any of that. So, just to recap, can you repeat back for me why we're going to change out your cap? Yep, because we're doing the blood draw. How often do we need to change it out if nothing's wrong? Every 7 days, yep, if it's clean. If we do see like any leakage or some gauze popping out or anything like that, we'll change it as need be as well, okay? And then we'll change it every 96 hours, yep, for lipid change. All right, so I'm going to go wash my hands really quick. So, I'm going to go ahead and raise up your bed here, and then I have a little mask here that I'm going to put on you, and then I'm also going to have you look out the window here, and that's just so that you don't look down while I'm changing your dressing, and we don't want you breathing on it, and I too will be wearing a mask so that I'm not breathing on it. So, I'm going to go ahead and give you this little mask here. And go ahead and look out the window for me. Alright, I've got some little hand gel here. Go ahead and put that on. And then I'm going to go ahead and put on my stuff. And this is just to take all the precautions that we need to make sure that your central line stays as clean as possible. We don't want any kind of infection. Do you have any questions? You're comfortable like that? Okay. Gloves. Go ahead and around the outside, clean this with alcohol so that it'll help loosen up. And then working from the outside in. First assess this for looking through this clear dressing, see if I see anything, which it looks clean. And then I'm going to go ahead and secure this while I pull it up. There we go. I'll look one more time through this. There's no drainage or pus or anything like that. Site looks okay. So I'm going to go ahead and get rid of my gloves and all that garbage. Put this on good. Make sure I've got everything I need. It's a little easier on myself when it's time to go and get that. Okay, so first I'm going to break this. You'll see it getting wet underneath. And then I'm going to go ahead and unsterilize this hand. I'm going to hold on here. And in the back and forth motion, I'm going to go ahead and clean, 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 clean around it. Okay. And then clean hand goes underneath, sterile hand on top. If I would be checking for any blood or leakage out here, I can go ahead and clean off any blood here. Okay. And then grabbing this here. Put that new sterile dressing on. Alright, sterile part is done. Now, I can adjust that part. So, on top of here is a little reminder piece. I would go ahead and fill that out with my name, or my initials, the date, and the time that it was complete. And then let's go ahead and tear it off. And then I can put it on there. Okay, so now we've got that done, we're going to go ahead and proceed with the ordered blood draw, after which we're going to go ahead and take out that tap and change it out. So, I've got everything I need here for a blood draw. I'll go ahead and perform a little more hand hygiene there. Put on some clean gloves. Okay. I'm going to grab an alcohol swab here. And I'm going to go ahead and clean this off with that tape. For 15 seconds, I'm going to go ahead and swab the very top of this. Okay, the environment. I have a flush here. I'm going to remove its cap. And without touching the tops of either, I'm going to go ahead and insert it, unclamp it, and using the push-pause method, I'm going to go ahead and push in 10 cc's of normal saline. Now before doing this, or on the last one, I'll go ahead and clamp it. Before doing any of this, if they had an active running IV, I would have paused that 2 minutes prior to doing this. So now I'm going to go ahead and pull out 5 milliliters of blood, and that will be for my discard. I'm going to pull that out and I'm going to clamp it. I've got sharps over here. Alright, now I'm going to draw out a clean syringe and go ahead and insert it here. Unclamp. The blood test I need will require 5 milliliters of blood, so I'm going to go ahead and pull out that 5. I'm going to go ahead and clamp it. I've got a piece of tape here. I'm going to go ahead and take it back out. So at the hospital we have a little device here, and this screws into that device. It has a needle on the end, and you can safely put the blood transfer the blood into the tube without poking yourself or any risks such as that. And then the whole device and blood all gets thrown in the sharp container. On top, on my blood label, I would write my initials, the date, the time, and the patient's full name and date of birth for identification. And then that would go into a biohazard bag to be sent down to the laboratory. Next, I'll go ahead and open up my new cap, and then we'll open up that and then stir without touching the ends. Go ahead and put it in and pre-flush it. And then we'll open up another alcohol swab. Go ahead and take this off. And I will go ahead and take off the top cap. And that will be put in the disposable container, sharps container. I will clean off the very top here for 15 seconds using good friction. Take this carefully without touching the top. Go ahead and unclamp it. Use the push-pause method. I'll go ahead and put in a full 10 milliliters. And then on the last one, I will unclamp it to keep pressure in the line. And then I have my heparin solution here. Same thing, then take off the top. Go ahead and insert it. Unclamp. This is only 5 milliliters of heparin that I need. So using the push-pause method, go ahead and put in that 5 on the last bit, clamp. I've got a new piece of tape here, and I can go ahead and put it onto the patient. I will then put the side rail, make sure that the call light is in with reach, make sure the patient is comfortable. Patient can go ahead and turn, be comfortable, take the mask from the patient. I'll go ahead and dispose of all my supplies in the appropriate sharps container and garbage as needed. I will lower the bed, perform hand hygiene, document the procedure and the blood draw, and then I will be back to check on the patient to make sure that the line is not having any signs of leakage or anything going on there.